Bismillahirrahmanirrahim. Today is 25th of November, and from the forum of Pyas, we are going to talk on a very important topic, which is the problem daily faced by the gynecologists and also by the other doctors. The topic is labor, which means the process through which the baby is delivered. The process through which the baby is delivered is called labor. Labor is divided into three phases, which are: number one, phase one is from the start of the true labor pains to the full dilatation of cervix or full dilatation of birth canal. This is the actual problem, the full dilatation of the birth canal, which is a timing consuming process, and this is the most difficult and the most problematic phase. The true labor pains are usually after 9 months and 1 week of gestation. Gestation means mudada mashum pagedake. 9 months and 1 week after the labor pain, true labor pains start, and from the start of the true labor pains till the full dilatation of the cervix. Full dilatation of the cervix means 10 centimeter or 4 fingers, because we need this much dilatation in order to have the safe passage of the widest part of the baby, which is the skull, the biparietal diameter. From the one parietum to the other parietum, this is called biparietal diameter. The biparietal diameter, it is this. From this to this is the biparietal diameter. This is the widest part of the skull, and the problem in the delivery of baby is the passage of the skull through the birth canal. Birth canal is the os and cervix and isthmus of the uterus. So the cervix and isthmus of the uterus, they both give you the birth canal, and opening of the birth canal to the required width, which is 9.5 to which is 10 centimeter. This takes time, and that is the time which is called the first phase of the labor, which is from the start of the true labor pains till the full dilatation of birth canal or cervix. And this takes there are three types of the pregnant woman. The woman which is having the baby for the first time, she is called primary gravida, and the woman who is having more than one pregnancies, this is called multigravida, and the woman which is having more than 5 pregnancies, this is called grand multigravida. So the number of times the woman has passed through the experience of delivery, that shortens the delivery time, meaning which that the first baby takes longer time than the other babies to be delivered later on. The first baby, the primary gravida, takes 24 hours in the delivery, and the 24 hours have been divided into 3 or 4 stages in such a manner that from the start of the true labor pains to the full dilatation of the cervix, this is called first phase, and which is usually 20 hours. And from the full dilatation of the cervix till, say, this is the birth canal cervix, and this is the part which is coming out first. The part which comes out first, or which comes out first to the birth canal, that part is called the presenting part, and normally the presenting part is skull. This is called cephalic presentation. When the skull comes, the presenting part is skull. From the full dilatation to the full delivery of the baby, that is called second stage, and that second stage is usually from 1 hour to 2 hours. Dilatation takes 20 hours, delivery of the baby takes 1 to 2 hours, and after the delivery of the baby, which is second stage. The third stage is from the delivery of the baby till the delivery of placenta, that is called third stage. And similarly, it is usually half an hour to 2 hours. If it does not deliver within 1 hour after the delivery of baby, then that condition is called retained placenta. Placenta is called kamar amla. And if the placenta does not come out, this is another problem which is called retained placenta. And there are other causes, there are so many causes of retained placenta, and how is it managed, we will talk on it later on. And from the full delivery of baby to the full delivery of placenta, this is third stage, and from the third stage, 1 hour after the delivery of placenta, that condition is so alarming condition, alarming phase, which has been given the name of fourth stage. And that is in that 1 hour, usually complications, if there are any complications, come across. The complications are usually PPH, which is postpartum hemorrhage, bleeding after delivery, PPH, and rupture of the uterus, and also the injuries to the birth canal, which are called tears to the birth canal, rupture of the uterus, and also the PPH, placenta delivery, the bleeding after the delivery of baby, that is called PPH, and that usually is encountered 1 hour after, in the first hour after the placenta, delivery of placenta, and that is why that 1 hour is also given the number of 4 phases of delivery, and which should be the patient should be kept under watch, so that no problem, no shock, no bleeding takes place. And mind it that you are not going to do anything drastically, anything seriously, just watch the patient, observe the patient, and the secrets are that give time to the better is to give, the longer you give the time, the better is both for the mother and baby. Watch, wait, and give time. The longer you give time, the better it is. Just see for the fetal distress. Keep on auscultating the heart of the baby, and also the fundus timely, and also do PVs means per vaginal examination regularly, but after some time, not so frequently that it is also you might not give infection, you might not give other problems to the patient. So have the timely assessment and periodical assessment, regular assessment, by examining the blood pressure of the patient, by examining the fundus, fetal height, the fundal height, and also look for the process or the progress of labor, which is do PVs and see what is happening. If there is any problem like fetal distress or maternal distress, then consult other colleagues and think of C-section, cesarean section, if there is no progress. If there is obstruction of labor, if the labor gets obstructed by one reason, there are so many reasons. If there is obstruction to the labor, then this is called obstructed labor, then the other choice is do C-section. Okay, C-section means cesarean section, taking the baby through the abdomen. That operation is called cesarean section. Okay, all right. So mental.